All right, so you definitely need to know how to do this movement, but you do not need your hands up here. This reminds me of a guy I saw at the gym one time. I think he had the movement correct, and I'm gonna explain why this is so important, but I think he somehow mixed it up with also like doing a sit-up because this looks pretty funny. So definitely, if you're gonna do it like this, don't do it at the gym. However, what is important though is this movement here, because if you take a look at our pelvis right here, and this right here specifically, the sacroiliac joint, we often get diagnosed from the medical professional with sacroiliac dysfunction, and that basically means general lower back pain. Now, the problem is when we look at this pelvic thrust, yes, everybody laughs because it also has some other positive effects in life, if you want to call it that. However, back to the physical therapy side of things, this is crucial because this is how your sacroiliac joint moves. If you can't move your sacroiliac joint, so like commonly I see people try to do this movement like this or with their knees, they're not able to isolate this movement, which is very important because if I were to send you to algebra class and never teach you addition, subtraction, or multiplication, and then assume that you're just dumb and you need Ritalin or Adderall or you're ADHD or you're ADD or you're dyslexic because you can't do algebra, that's not fair because I never taught you the components that make algebra up. So if we have lower back pain and we are not able to isolate this movement, giving you an injection to basically put duct tape over the crying baby's mouth makes no sense because we're not understanding what that baby in this example needs, or just taking medicine to block the pain only allows you to continue to move terrible, do whatever you're doing, not feel the pain, and continue to do the damage. So what we need to understand is how we can learn to do this movement, and when we start doing this movement, we're probably not going to get sacroiliac dysfunction because it's no longer dysfunctioned and you're actually able to move it. And when you're able to move your pelvis and your sacroiliac joint has this ability, so again, this area down here, this joint specifically right here, I show it again right there, when that joint can move, that is scientifically evidence-based medicine, everything from common sense to every doctor in the world to every paper ever written, proven and correlated to say that then your pelvis is healthy, and when the pelvis is healthy, slip disc, lower back, ruptured disc, back surgeries, your spine falling out of your ass, whatever, will not happen because the area is functional and you can move it. The problem is this movement here is so taboo because of what else it looks like. But if you can't do this and you go to the doctor and he wants to give you an injection and all that jazz, it's not necessarily the wrong thing. I'm not a big fan of injections. I don't even take ibuprofen for that case. However, if he gives you something and he doesn't test your movement, he does not even realize you can't do this. You go home and you realize you can't do this. You need to learn how to do it. Because if you don't, you're not fixing the problem. You're not going after the solution. You are literally just masking the symptoms, which then allows you to basically drive across country with your parking brake up, and you're going to pay the price later when your car catches on fire, when your tires get smoked and your brakes are destroyed. So instead of destroying your lower back, you need to learn I would say understand the why and the importance of this motion and how you can do it. So let's go ahead and discuss a little bit and we can break it down with how you can start doing this. A lot of times I like people lying on the floor, which, you know what, actually, why don't I pause this video and let's start on the floor. So starting with this position on the floor really helps because you can have your knees bent so you're really just lying on your hips. I would suggest not having your legs straight on the ground. It makes the movement a little bit more difficult to understand and also puts a little bit of stress on your lower back. So right here, I'm gonna hold my right hand up a little bit just so you can see a little bit better. But you're gonna notice I have a curve, boom, right here in my back, right? And so what I wanna do, well, actually, funny enough, if you really can curve it, right now you're in the anterior tilt position, which I'm gonna talk about when we stand back up, but basically you're pushing your butt back right now. You're getting that duck butt, if you will. And the other position is, imagine you're trying to flatten your back out. So one of the physical therapy exercises we often do is we will put a towel under the back. So like fold it up kind of so it's like a square. And then as I tell the person to lower their, to basically tilt their hips we would say a posterior tilt in this one, right? I have to think about that for a second. To flatten their back is what we would say, is then when we pull on the towel, if that back is now flattened, then the towel won't move. And then we say, okay, release it, and then we can move the towel. Okay, flatten that back again. And that teaches them one motion of this anterior tilt, because I like to break it down and chunk it a little bit into two separate movements instead of trying to teach the person the entire thing at once. So the first one is we can really kind of flatten that back. We can work on this, and I have to think for a second. This posterior tilt, sorry, lying down is a little bit funny to think about it. I'm usually over the person talking. So from here, we're working on this posterior tilt. So I can imagine I'm really trying to flatten my back against the ground. You can see me do it as I'm chatting. And then from here, I can also now go into this anterior tilt where I'm really trying to increase the area below my back. So it's almost like I'm trying to make a tunnel for a little mouse to go through, I guess, right? And so from here, I can now practice just on that movement there. And then once I feel comfortable with it, I can actually move into both positions. All right, here's a little bit of a bonus section actually, because I said in the video I was not going to talk about from the knees, but I think it's important to understand because now from the knees, as I said when I was talking about the standing position, it takes my knees out of the picture, which is where a lot of the mistakes come from. So if you find yourself standing up and you're moving too much from your knees, drop on your knees because that's now going to basically you're going to block them against the ground. So you're going to realize that where you want to move from your knees, now you can't really do it because when you're standing, your knees are an open joint and now they're blocked against the ground. And from here, you can do the same thing. You can practice on tucking your butt under. So as I said in the standing position, I tell the kids, it sounds terrible, but imagine there's a thumb in your bum, boop, and you try to push it forward and close it. And then the other one is imagine you're going into this duck butt position. You're trying to get your butt against the wall and we're trying to make the movement as clean as possible. So really no excess upper back movement. Now your knees are going to be blocked, so it's going to be very hard to move from your knees. And obviously your ankles can't do anything because they're not really a part of this picture, if you will. So this is the second position. So again, to reiterate what we should do, start by lying down. The second position would be here and the third position would be standing. You don't have to do it in that order. However, if you're struggling with understanding how to do this movement, that is the exact order you want to do it in because it's the nicest, the calmest, and the easiest for your nervous system for it to learn a new pattern. And when you can make it easier to learn that new pattern, then your body will adapt it into its everyday life, like sitting, standing, getting on the ground, getting in the bed, getting out of bed. All of these things, once you learn how to do this, you don't have to think about it anymore because your body will naturally start doing it. Therefore, your SI joint starts to move again. When it starts to move again, the dysfunction goes away. When the dysfunction goes away, your pain goes away. And when your pain goes away, you get back to doing what you want to do and you don't need those goddamn injections or chiropractic appointments or whatever anymore because you're moving healthy and it feels great. It's really, really, really that simple. Now I want to show you how to do it standing up. What I want you to do is I want you to stand with your knees super tight, squeeze them as tight as you can, and then relax them. That is a good little posture trick because that is exactly where our knees should be when we're standing. And from here, what I want you to try to do is take your butt and tuck it all the way under. Now you're going to recognize that your shoulders might fall forward when you do it. That's quite interesting because it actually shows that your shoulder position is completely dependent on your hips, which is why I believe the engines of your body are your hips and your shoulders. And that's why we always need to address the hips to really fix truly any shoulder problem. That's a different video, but either way, I've tucked my butt under, so it's kind of tight. I always tell the kids, imagine someone's trying to stick a thumb in your bum, and they go, boop, they squeeze it tight, boom. Now you have curled your butt under. You have learned how to posteriorly rotate your pelvis. Now what we want to do is we want to go into the duck butt position and try to really get my butt as if I'm trying to touch the wall behind me. I obviously don't have a wall behind me, so you're going to have to use your imagination. But from there, I can then go back into thumb in the bum, all the way here. Now you might recognize that you have excess knee movement while you're doing it, and even maybe upper back movement. If that's happening, don't worry about it. That's fine. Because first we need to get a general idea of how to move, and then as you do it more and more and more, you will start to clean up the motion and realize that it's much easier to tuck it under and then move it back out. And from here, my biggest suggestion is start with one movement. Try to tuck it under first. Tuck it under, and then say, okay, that's cool, stop. Tuck it under again. Okay, cool, stop. Now, go the opposite direction. So now we're gonna try to anterior rotate it. Maybe I turn it a little bit more. Anterior rotate it again, and then I can just try those motions. I can separate them. I can break it up into small little chunks, if you will. And then once I have the feeling of what it should feel like, I can put it together just like that. Now, this looks a little bit funny. Like I said, I had a client, well, actually not a client, someone in the gym that used to do it like this, which actually looked pretty funny. And then even worse, sometimes he would grab the stretching ballet bar in front, so then he was like this. That looked hilarious. So maybe take care where you do this. I've got my windows open here because of the natural light, so I'm sure my neighbors think I'm crazy. So it's a little bit of a funny looking exercise, of course, just because of what else this relates to. However, I can't express the importance of knowing how to do this for your sacroiliac joint so it can move, so you can prevent, at the beginning, lower back pain, but in the long term, ruptured discs, slip discs, the need for some fusion, and also you can understand that when you do go to the doctor and they want to jack you up with all this jazz from injections and medicine and surgeries, if he's not asking or checking your movement, then that should be a red flag for you in saying, okay, well, why are we just looking at masking the problem, duct taping the baby's mouth that's crying, versus actually fixing the problem? So if you enjoy these videos, please, if you have not yet, subscribe to the channel, drop a comment, share it with your friends, engage, because the more you engage with my videos, the more they are able to help everybody out. If you are not following me on TikTok, Unbreakable Body, or Instagram at RehabGTS, please do so, because I do videos every single day, a short little one in the morning and then a longer one in the evening, and then I do the most intensive one on YouTube. So please check out all of my channels. All of the descriptions are below. If you want to work with me one-to-one, I have a fantastic Unbreakable Body 3-month online course, and I also have a very cool free 5-day challenge. So everything is in the links below. Like I said, subscribe, share it with your friends, and until next Monday, Wednesday, or Friday, whenever you're watching this video, I will see all you beautiful boys and girls and non-binaries soon.